Talking about tuberculosis right now, commonly known as TB. It remains a leading cause of death around the world, and drug-resistant TB is on the rise. But researchers have recently identified a promising new compound to treat it. Here to tell us more about the team involved in this development, how the compound works, and what it could mean for patients is infectious disease expert Dr. KUSI McNamara. Good to see you, Doctor. Thanks for coming by.
It's very nice to be here. I have to share with you, I'm born and raised in San Diego, so I have a lot of family and friends watching. So hi, Mom.
All right. Well, we're glad you're here.
Yeah, thank you. Thank you.
Want to just give us the 101 on tuberculosis and that what you and the other researchers have found, this kind of compound, you and the folks at Scripps?
Yeah, let me start with the background. So TB, it's a respiratory disease caused by a bacterium. So what happens is it's going to get into your lungs. It kind of creates hot spots, essentially, that over time will turn into lesions. Okay. And those lesions, once you treat this patient, will actually scar and lead to decreased function. So not only is this disease lethal, but it could still be debilitating to those that do survive.
Sure.
So what we've done is, essentially we've come up with a new medicine at the institute that I work at. So it's the Caliber Skaggs Institute for Innovative Medicines. It's a mouthful. And we call it CMX 410.
Yeah.
And this molecule is highly effective against drug-resistant bacterium and kind of uses a new technique, new mechanism that we think is quite exciting.
Well, so what do you do with this information? How do you move forward to try to treat tuberculosis?
Yeah, so it's a long process, a process that would take 7 to 10 years before it actually gets approval. So where we're at now, still, it's preclinical. So we've gone through animal models and we've shown that it works very well, that it's safe, and the next steps would be try to move into human trials to test for safety, pharmacokinetics.
Are you using rats or mice? Is that how it works?
Primarily mice, yes.
And you make sure the mouse has tuberculosis, and then you try all of these different things to try to kind of cure it of its tuberculosis.
Absolutely. So the same bacterium that causes human disease will also cause mouse disease.
Interesting.
So we're able to model that.
Can you kind of bring us back to that aha moment, or what got you to the aha moment?
Yes, yeah, happy to. So this kind of starts with a colleague that's at Scripps Research Institute. His name is Barry Sharpless. He's a 2-time Nobel laureate, so just ridiculous person to be able to work with. Really wonderful and kind. And what he figured out very early on was how to put molecules together very rapidly and easily. His idea was, instead of just building molecules, why don't we repurpose this technology into inhibitors? So he gave us a small library. We said, we'll test those. We tested them against TB, and sure enough, we found some compounds that were highly specific that only killed TB and nothing else. So fast forward a couple of years, we optimized that hit into CMX 410, and now this is what we hope to make.
Great. So you work forward from here. I'm curious, did AI assist you in anything in this?
That's a really good question. No, we did not take advantage of AI in this. This is just...
Do you think AI might help you now that you have this beginning point to find something?
Yeah, actually, without going into details, we know the target, we know what it looks like docked in there, and we could actually use AI perhaps to kind of redesign or make a better molecule.
All right. KUSI McNamara from Scripps. Well, congratulations.
All right, thank you very much.
We'll have you back on. You did a great job. Thanks for coming by.